Why do uterine problems lead to recurrent pregnancy loss? Imagine a woman who has been trying to conceive for some time and keeps experiencing pregnancy loss. Often, the underlying cause can be linked to issues within the uterus itself. Uterine problems can interfere with the delicate process of pregnancy from the very start. They can be present from birth or develop later in life, and they affect the structure, blood flow, or lining of the uterus, all of which are vital for a healthy pregnancy. One common reason uterine problems lead to recurrent pregnancy loss is structural abnormalities of the uterus. These are often congenital, meaning they are present from birth. For example, a septate uterus has a fibrous or muscular while dividing the uterine cavity, which can limit space and impair blood flow. Other types include a bicornuate uterus, which has two horns or chambers, a unicornuate uterus with only one side developed, or a didelphic uterus, where two separate uteri exist. These malformations happen because the embryological structures called Müllerian ducts do not fuse properly during fetal development. The septate uterus is especially linked to pregnancy loss because the septum has poor blood supply, making it difficult for an embryo to get the nourishment it needs, often leading to miscarriage, especially in the second trimester. In addition to congenital issues, acquired uterine conditions also play a significant role. Fibroids, which are benign tumors of the uterine muscle, can distort the uterine cavity or block blood flow to the developing placenta. When fibroids grow into the cavity, they can physically prevent an embryo from implanting properly or cause problems with placental attachment. Polyps and intrauterine adhesions, which are scar tissues inside the uterus, can also interfere with the environment needed for implantation and growth. These conditions can make the uterine lining less receptive or disrupt the normal process of pregnancy. Blood supply to the uterus is another critical factor. Uterine abnormalities often lead to decreased blood flow to the endometrium, the lining of the uterus. This lining needs to be rich in oxygen and nutrients for the embryo to embed and develop. If blood flow is compromised, the endometrium cannot support the early stages of pregnancy, leading to early pregnancy loss. For example, areas like a septum may have poor vascularization, making it difficult for the embryo to thrive. Women with uterine abnormalities may also face other reproductive challenges, such as difficulty conceiving, preterm labor, or abnormal placental development. These issues can further increase the risk of pregnancy loss. It is also important to note that conditions like endometriosis can indirectly contribute to uterine problems. Endometriosis causes inflammation, scarring, and adhesions within the pelvis and uterus, which can alter the uterine environment and make implantation less likely to succeed. In summary, uterine problems lead to recurrent pregnancy loss because they create an environment that is either mechanically or biologically unsuitable for embryo implantation and growth. Congenital malformations reduce the size or blood supply of the uterine cavity, while acquired conditions like fibroids or adhesions disrupt the lining or blood flow. Addressing these issues through medical or surgical treatments can significantly improve the chances of a successful pregnancy. If you suspect uterine problems may be affecting your fertility, it is essential to consult with a healthcare professional who can evaluate your specific situation and recommend appropriate interventions based on your individual needs.